Actually, I spend most of my time practicing northeast Iowa, across the whole, probably top half of Iowa, southern third of Minnesota, and then also into Illinois and some of the states further east. But I spend the majority of my time in pretty hog-dense areas, so on any given day, I probably deal with some disease or another. So this talk really is pointed towards people that spend all day long in pig barns. Okay, so from a raise of hands, how many guys are in pig barns every single day? All right, that's good, because that's my goal here, is to talk about what we can do in pig barns. Also, if you got questions, or you think of questions later on, I'll throw some business cards down for you here on the table. You can shoot me an email, call me, anything like that. So anyway, let's get into it here. Recognition, prevention, and control of swine diseases. Really, it starts before the pigs ever hit the barn. Okay, we need to have a plan in place, what we're going to do as soon as these pigs come into the site. Okay. First thing is, before they come, was the barn clean? Is it clean underneath the feeders? You know, great place for E. coli to grow, guys, underneath feeders. So underneath the feeders, great place for E. coli to grow. If you've got E. coli issues on every group, great place for E. coli to grow if we're not flipping those feeders up, cleaning them out. Load out. You got to remember that's the first place that these clean, healthy pigs are going to come into. That's also the last place that you just backed up a truck that was at a packing plant. Okay, so definitely a place to make sure we're clean. Another place that gets missed is the office entryway. Sometimes I'll go to barns, and they did a great job cleaning the inside of the barn. Everything looks good. I go into the office, the workroom there, and it's a disaster. Okay, so want to make sure we're not missing that. I'm a big believer in using Synergize as a disinfectant. Dose on that's 1 ounce per gallon. That's my number one disinfectant that I go to in most situations. Make sure the barn's dry. Really, it's the cheapest disinfectant you can buy. You know, heat kills a lot of bugs. Okay, dryness kills a lot of bugs. Okay, so make sure the barn's dry. Make sure the barn's warm. That doesn't mean you turn up the heaters when the truck arrives. Okay, that means you start warming up the barn the night before. Okay, how's the barn set up? How are the feeders set? Most of the time you go in and you wash the barn. You open the feeders all the way up so the water can drain out, that type of thing. But if you did a good job disinfecting that barn, what's going to be in the bottom of that feeder? There's going to be a little bit of water in there. It's going to have disinfectant in it. I don't know for sure, but I think Synergize tastes like crap. Okay? So that's the first place we want those pigs to go, is to start bellying up and eating. So make sure that we've either sponged out those feeders or we've blowed them out with a leaf blower or that type of thing. Make sure that we got the feeders clean. Make sure the feed's been delivered. It's in the right bin with the right slide open. Again, there, water. Make sure that if you're using cup waters, that it's clean and dry. There again, that we don't have Synergize in the bottom of that. So the first thing they taste isn't Synergize. Okay. Make sure our ventilation is set up. If we use a curve, make sure it's been set so that the new pigs are ready to go for the new pigs. And that you know when the pigs are coming. Then also, I like to have a plan in place. What are we going to do with these pigs when they come in? Okay. I'm a big proponent of utilizing all space in a barn. But we do need to have some pens set aside for small pigs, or for hospital pigs, or for graduation pens, okay? So I need to have a plan set up there, okay? And we'll skip into, this is a typical 1,200 head barn that I deal with a lot in my area. And you can see that we have pens set up there. And based on us getting 1,200 pigs in, I'm going to put 105 pigs in all of these pens here. Okay. Then I took this last pen here and I designed that so that I can do better individual pig care in the barn. Okay. So I had to overstock my general population pens a little bit more to generate some empty space here to use for my hospital pen, my graduation pen. We'll go over that a little bit more later. But, have this in place so you know how you're going to stock your pens and that type of thing. Okay? Make sure that before your pigs come that you know what you're going to do. Okay? Have the pigs been vaccinated for mycoplasma or circovirus? Or are you going to have to do that? Okay? Are we going to vaccinate for ileitis? Are we going to vaccinate for erysipelas? Guys, it's important. I try to always write down my plan for my producers. Okay? This is what we're going to do, guys. Okay? Write it down on a piece of paper and it's in the office. Okay? We have a plan in place. What's our feed med program going to be? What's our water med program going to be? Okay? Have it outlined. Okay? It may change 2 weeks later, but at least have a baseline of where you're starting out. I'm a proponent of sorting pigs by size when they first come in. I know not everybody's probably going to agree with me. Does that mean that I want to sort every pig top to bottom? Nope. Does that mean I want to sort the bottom pigs off? Yeah. So I want to sort maybe the smallest 5% of the pigs off, okay, when they come in. Depending on how your pigs are coming in, maybe you're going to sort the bottom 2% off, 3%, 5%. Bottom line is sort the smallest pigs off. This pig, am I going to go in and resort this whole pen here and say that pig is bigger than this pig? No. But you see that little hamp pig in there? He's the one I'm going to sort off. Okay? The rest I'm going to leave alone. But that little hamp pig there, you can see that he's going to struggle at the feeder when he's next to these two big pigs. Okay? So that's what I mean by sorting the pigs by size. Okay? Make sure you're leaving some pens open. This shows a nursery pen here. There you can see a normal pen. I just left one pen empty to sort off pigs in. Okay? You gotta need some extra space to sort pigs off. Okay? Worst case scenario is, or best case scenario, I guess you could say is, Doc, the pigs never got sick. We didn't have to sort any of them off. What do you do then after they've been in there a month? You just go in and sort some pigs down to fill that space. Start out with the empty space, though, initially. A lot of times when I fill a barn, I want to have, if I got multiple pens available, I'll have some where I'm putting my healthy fall-behind pigs, small pigs that come in off the trailer, and then I need some empty pens that we're going to use to pull treat pigs, okay? So, when I talk about individual pig care, I want to know how you're identifying the pigs that you're treating. Okay? Nothing bugs me more than to go to a site and I ask the person, how many pigs are you treating a day? He says, 25 or 30 a day. And I walk in the barn and I don't see a single mark on a pig. So does that mean he's not marking them? Or does that mean that guy just kind of lied to me? Okay, so I like to use a marking system, and I really encourage my producers to use a marking system. Different colors, different parts of the body, the number of injections, the day of the week, I don't care what it is. Develop a system, use it. Okay, so, whether you're using paint sticks, spray, whatever, but use it. Okay. As an example, maybe you mark them by the day of the week. Pigs that I treat on Monday and Tuesday, I put a red mark on them, Doc. Ones I treat on Wednesday and Thursday, I put a green mark on. The ones I treat on Friday and Saturday, I put a blue mark on. And Doc, I'm going to be honest, I don't treat pigs on Sunday. That's fine. Okay? We got a plan in place, though. Maybe you do it by the injection. Okay, first injection, I put a red mark on that pig. If I need to come back and treat him a second time, I put a green mark on that pig. Develop a system. Okay? Here's a picture from a barn. It's kind of hard to see, but if you look close, I got pigs with pink marks there. I got pigs with blue marks there. They're treating pigs. Okay? Make sure that we're looking at every single pig every day. Okay? If we want to catch pigs early enough to get them treated so they respond, we need to look at every pig every day. If you do the math, it should take about 2 to 3 seconds per pig. That means on a 1,200 head barn, it should take you 40 to 60 minutes to walk through that barn and look at every single pig. Okay? That means that you shouldn't be able to chore a 1,200 head barn in 10 minutes. Okay? Because it's going to take you 40 to 60 minutes to look at a 1,200 head barn. Okay? To be successful, the pig needing treatment needs to be found at the proper time, not too late. More important than deciding what drug to use is getting the pig pulled at the right time. Okay? More important than deciding, do I use Exceed or do I use Draxxin? I'm more concerned about getting that pig treated with something early. Okay? The right time. So, head to tail assessment, we're looking at the pig. We're looking for discharges out of the nose. Is that spine showing? Is that pig thumping? Does he have a full belly? Does he have swollen joints? Anything abnormal on that pig? Okay? So I tend to go with the ABC type thing when I'm looking at pigs. Okay? All sick pigs start their disease as an A pig. Okay? Actually, an A pig doesn't look too bad yet. Okay? Still got some decent flesh. He's not real rough-haired. Doesn't look really tough. Okay? He looks like that. Okay? If you look at this pig here, actually he doesn't look too bad. But if you look, he just looks a little depressed. His ears are back. This pig here, starting to lose some belly there. Ears are kind of laid back, looks kind of depressed. This pig here, starting to look kind of depressed, doesn't look too bad. Great place to find these type of pigs sometimes is laying against the gating there. Sometimes, a lot of times, I've found these pigs are laying pretty close to the feeder. Okay? Reason being is they don't feel very good, so they may go up, nibble a little bit, then they go lay down at the closest place. Okay? So, these pigs don't look too bad yet. Okay? This is the time to catch them. All right? A B pig. Remember, a B pig started out as an A pig maybe 12 hours ago, maybe 8 hours ago, maybe 2 hours ago, maybe 24 hours ago. But B pigs, they're definitely starting to show more clinical signs. They're probably more gant. We're losing more belly, more flesh. Spine starting to show more, maybe rougher hair coated. And they may be dirty looking. The reason they're dirty looking is because they're laying there and they don't feel good, so they go and lay easiest place they can get. Maybe a shitty part of the pen. Okay? So B pigs, you can see that these pigs just look a little tougher than that last slide I showed. You can see that don't have as much belly there. They're gant. They look more listless. You can see this pig here is starting to get some purple ears. More hairy looking there. They're just starting to look tougher. Okay? It's going to be tougher to get this pig to respond to treatment, isn't it? Versus those pigs we showed in the previous one. C pig. Okay? C pigs look really tough. Okay? Severely gant, spines showing. They're severely depressed. They look really bad. Okay? They look like that. Okay, what's the chances of that pig responding to treatment? Not near as good of that pig responding to treatment versus those ones I showed you in those first slides, is it? Okay. Unfortunately, I see a lot of barns where by the time a pig gets treatment, they're at this stage. Okay? As much as I hate to say it, guys, the best treatment for a pig that looks like that, or like this here, might not be an antibiotic injection. What might it be? Euthanasia. That's right. We missed the ball, you know. And as much as I hate to say it, from a welfare standpoint, euthanasia is a treatment in a case like this. Okay? So we want to catch those pigs early. Why do we want to do a good job treating these pigs? Catching them early, getting them treated, that type of thing. First off, guys, you know, we're in the pig business because we don't want to work in a factory all day long. We care about animals, right? It's the right thing to do. You know, ethically, it's the right thing to do to get those pigs treated soon, okay? There's a high level of success when we identify that pig early. We treat it with the right drug, the right dose, the right time. Early, okay? If you see that early appeared twice there. Identifying it early. Big deal. Sooner you catch them, the better off you are. So there's my A pig again. Doesn't look too bad. I think if we treat him, we got a pretty good chance of success. We might not even have to sort this pig off. We might be able to leave him in the pen where he was at with his cohort pen mates. We give him a shot of an antibiotic. We mark him. We can check him a few days later. But we may be able to catch that pig soon enough we don't need to sort him off yet. This pig here, he's tougher looking. If we leave him in the pen with 104 other pen mates, he's probably going to get pushed back, isn't he? We probably need to get him sorted off. Okay? Need to get him into a hospital pen. He needs probably some extra nutrition, some extra heat, some extra space, as well as that antibiotic. Okay? C pigs there, I think most of the time we're too late. You know, if we have a pig that looks like he's been down on his side for 12 hours paddling, we're probably not going to get him, cured. If we got a pig that looks like this, chance of treatment's really low. Euthanasia is probably the best option. Okay? Hopefully we catch him in that A period as an A pig. If we happen to miss him as an A pig, we catch him as a B pig. We shouldn't be catching him at this stage here. Okay? You can see how those pigs progress there. So it's critical that we catch these pigs early. Okay? Then the one thing that I see sometimes in situations where guys are doing a really good job catching the pigs early, we need to make sure that we're looking at them, reevaluating those pigs to see how our treatment was. Did they respond to treatment? Have they started going up to the feeder? Are they starting to belly up? We need to follow up with those pigs. Just not pick a pig out of the general population. I give him a shot of Exceed. I throw him in the hospital pen. Forget about him. You need to go back, reevaluate those pigs. So there again, you need to pull those pigs out as soon as possible, as soon as they're identified, because 24 hours means a huge difference on a sick pig. Okay, sort and pull down pens, variety of sizes, shapes, that type of thing. One thing I really want to stress here is extra nutrition is essential for these sort off pigs. Okay. The reason I say that is a lot of times the first time somebody asks me is, what do I shoot these pigs with that I'm sorting off, Doc? Should I shoot them with Exceed? Should I shoot them with Baytril, penicillin? What? Okay. That's always the biggest question that people ask me. Really, another important thing is nutrition. Okay. Why? Okay. Couple things. First off, a lot of the if you think about it, you give them a shot of Exceed or Draxxin. There's no calories in that. Okay? So there's no calories in Exceed or Draxxin. We got to get extra nutrition into that pig. Okay? The other thing that's really important is extra heat. Okay? That antibiotic shot doesn't keep that pig warm. Okay? If he's running a fever or he's got some diarrhea or something like that, he's going to be cold. So we need extra heat. A lot of the diseases that we deal with now are viruses, aren't they? We deal with PRRS, we deal with influenza, we deal with PED, Delta coronavirus, TGE. They're viruses, okay? How effective are antibiotics against viruses? They don't work, right? So, yeah, getting an antibiotic injection into that pig is important, but this is just as important right here, okay? So if I have a hospital pen, I like to have some high energy products available that we can use for those pigs so that if that pig only eats a little handful of feed, it's got a lot of calories in it, okay? And if that pig really doesn't feel good, I want to have some sort of calories as a liquid so that he may go up and lick a little liquid before he eats feed. So having some of that available is important. So I like using, there's tons of them out there. You know, there's electrolytes that you can mix with water. There's gel products. There's really good pellets out there. High energy products in your hospital pen. Okay? Next thing is, make sure that it's easy for those sick pigs to access those high energy products. Okay? I'm a big believer in using some sort of gruel pans or something like that on these post-weaning pigs that are maybe weaned, you know, a few days up to a few weeks, so that you can mix up some gruel in there. You know, put a little bit of pellets in the bottom of the pan. Then I add some water to it. Then I add some baby pig restart, so I have this nice, really sweet smelling cereal. Okay? So, great way for get those bottom end pigs, those sick pigs to get going. Okay? Nutrition. Okay? There's an example there. There you can see. I like using these Rotecna feeders a lot in wean to finish barns. And even in nurseries, okay? I'm a huge believer of these feeders right here. So anyway, we've made up a feeder, fill it with pellets and water. A minute later, you can see that pigs are starting to come up to the pan. Within a couple minutes, that pan's surrounded, okay? These were actually, I took these literally in a wean to finish barn that I happened to be in there. I filled up the gruel feeder and I mean, they come right up, okay? So, no antibiotics in any of this here. We're dealing with nutrition, okay? Heat, okay? There again, we know these pigs are going to be running fevers, okay? If you've got a cold or you got a flu or something like that, and you're at home and you're running a fever, what do? You sit in the recliner or you lay on the couch, you put blankets on you because, you're shivering, you're cold, okay? You need to have extra heat available, okay? I like personally using heat from above, whether it's a heat lamp or a brooder, but I like using heat from above, okay? Because I think it does a better job keeping that pig warm. There are some people that use heat mats, especially in nurseries, but I'm much more a fan of these here, I guess. And then the other thing is having mats that allow the pigs to sleep on that doesn't pull body heat away. Okay? If you have a pig that lays down on concrete, that concrete's going to pull heat out of the pig. Okay? If they lay down on one of these mats here, it's not going to pull heat out of the pig like concrete does. Okay? So having something solid for those pigs to lay on. So nothing fancy here. This is a hospital pen in a 1,200 head wean to finish barn. Okay? So you can see here, it's a little hard to see. You can see we got a brooder hanging above them right there. Okay? We also have a board here over the concrete slats. Okay? We've got an extra feed source there that we can deal with these pigs here. You can't see it on this picture, I apologize, but there actually was a gruel pan right here too. So it's got everything. It doesn't look that fancy. It's got everything we need in that hospital pen there. There you can see a hospital pen and a nursery. Here they're actually using an electric heat mat. Really for the only reason is this guy used to farrow up until like a year before this. He's got all these heat mats that was left from farrowing crates. He says, I'm going to use that as my supplemental heat in my nursery. Fine. Got a couple gruel pans there. Here you can see a wean to finish barn. We're using these disposable mats here so the pigs can lay down, that they don't have the heat pulled off them. There's a nice gruel pan or pellets there too. So the big question that I always get asked is, what antibiotics do I use? There is no one antibiotic that's going to work for everybody every time. Okay? So more importantly, like I talked before, is more important than what antibiotic is getting that pig pulled early and treated early. Okay? So, what antibiotic do you use? The first thing is we want to know what diseases or bacteria are we treating. Okay? That's the most important thing, because it doesn't make a difference if penicillin is cheap and Exceed is expensive if penicillin doesn't work for the bug we're treating. Okay? So, most important thing is find out what you're treating. Okay? How long will an injection treatment last? That's a big deal for some people, because they say, Doc, I take care of 6 barns. I need something that's going to last a little bit longer, because I can't keep repeating injections every day. Okay? I know it's going to be a little more expensive, but I need something that's going to last a little bit longer. So, and then the last thing that I consider is cost. Okay? If there's 2 antibiotics that are going to last exactly the same amount of time, they're going to treat exactly the same thing, then I start looking at cost. But that's so far down that I probably shouldn't have even put it on there. Okay? So, here, and I don't expect you to be able to see this exactly and all that, but here was a chart that I've used with producers before, where you can see where we have antibiotics listed across the top. We got bacteria listed across the bottom. And based on label, these are the antibiotics that should work on these bugs. Okay? As an example, at the bottom here, I've got E. coli here. Okay? More than likely, penicillin is not going to work to treat E. coli. I don't care if it's the cheapest antibiotic there is. It's not going to work. We're not going to use it. So, make sure that you know what bugs you're treating, if the antibiotic is going to work against it or not. The next thing is, when I look at treatment cost, okay, I don't look a lot at bottle price of an antibiotic. I look at how much is it going to cost me to treat a pig for a certain period of time. Okay? If you look at the cost of Draxxin, it looks pretty damn expensive, doesn't it? When you get that bottle of Draxxin, holy crap, that stuff's expensive. Okay? But, it can treat a lot of pounds. The original Draxxin was a cc to 88 pounds. The Draxxin 25 is cc to 22 pounds. But anyway, if you look at it, that bottle's dang expensive, Same thing with Exceed. A bottle of Exceed, whatever it is, 85, 90 bucks. Looks pretty dang expensive compared to that $6 bottle of penicillin. Right? Okay, but really what I look at is, you got to look at how much is it going to cost per pound to treat that pig? How many days of coverage are you going to get from that injection? How much does it cost to treat per day? So what would a 5-day treatment cost? Okay. So if we look at penicillin, and maybe it's going to cost us 3 cents a day to treat that 20-pound pig. 5 days of injections, it's going to cost 15 cents. Labor's free, right? Wrong. You know, if it doesn't get done, you know, but 15 cents for the actual antibiotic, okay? Exceed, you're going to get 5-day treatment with 1 injection. It's going to cost you 37 cents. Okay, it's cost you twice as much, but you gave 1 injection, right? So you saved a lot of time. Is the Exceed going to cover more than your penicillin? Probably. So you really need to evaluate what antibiotics you're going to use on a regular basis. Sit down, have that conversation with your veterinarian, your caretakers, your whoever, you know, but have that conversation. This is the plan that we're going to do, and this is why. So all antibiotics are cheap if they're effective. Okay? If it costs me 75 cents to treat this pig and it works, it's cheap, right? I just saved a $40 pig with 75 cents, okay? All antibiotics are expensive if they don't work, okay? If I treat them with Exceed, it costs me 75 cents, whatever it is, and I save a 40-pound pig, that was cheap, right? If I treated it with a nickel's worth of penicillin and it died, that was pretty expensive, wasn't it? So, they're cheap if they're effective, okay? As an example, treating some pigs with strep, okay? We can treat it with 3 injections of penicillin, we spend a dime. 1 injection of Exceed, we spend 37 cents, okay? Both treatments are probably going to work, right? So, both of them are probably going to work against the strep, okay? Is strep more likely to be resistant to penicillin or Exceed? Nope. Both of them are probably going to work. Will penicillin be as effective as Exceed against other pathogens? Probably not. We're going to get some other good out of giving them the Exceed versus the penicillin. Okay? So, is cheaper better if we don't have nothing other than strep? Maybe it's okay. So if we're looking at cost, which is longer lasting, which is more convenient, which is broader spectrum, you need to decide, what drug you're going to use and stick with it. So, somebody say, what antibiotic do I use for general fall behind pigs following weaning that may have little diarrhea, may have a little cough? They just don't look right. My ain't doing right pigs that I'm pulling out, okay? So, you can say, well, I can use Exceed. That gives me 7-day therapy for 37 cents. I could use Baytril. That gives me 2 days of therapy for 53 cents. I'm going to choose Exceed because it's a little bit longer lasting and it's a little bit cheaper. Or I'm going to choose Baytril. Yep, it's a little more expensive, but you know what? I see a little diarrhea on some of my pigs. I think they've got some E. coli. I'm going to use the Baytril. Okay. I'm not here to tout one antibiotic over the other, but you just need to consider these things when making a decision. Okay. Another pet peeve of mine, I guess a little bit, is accurate dosing of injectable antibiotics. A lot of these antibiotics now are what we call low dose. Exceed a cc to 44 pounds, and you're going to treat a weaned pig that weighs 12 pounds. Well, how much are you going to give him? The people that make Exceed was pretty darn effective. It's not like you can dilute that stuff out. I'm old. Okay, I remember diluting out antibiotics to get them in lower volumes. You can't do that, okay? So, I'm a big fan of using what I call these low dose type syringes, where I can put a bottle of something on this syringe. I can wheel that syringe down so that it shoots 0.2 cc's or 0.3 cc's, okay? Big fan of that because not only do we get the accurate dose into them, but we don't waste it as well, okay? So an example protocol of this farm, say, is we're going to sort off pigs for treatment into the hospital pen. We're going to give them a shot of Exceed. We're going to put a red mark on them. We're going to reevaluate those pigs in 5 days. If that pig is fully recovered, we're going to move him to the graduation pen. Give him a little extra time, some better pellets, that type of thing. If he's looking better, but he's not fully recovered, we're going to retreat him with Exceed, put a blue mark on him this time. If he's looking significantly worse, we're going to euthanize. Okay? This is an example. This is not something that's going to work for everybody. This is an example of a plan. Okay? In addition to that, in our hospital pen, we're going to have 2 heat lamps for extra heat. We're going to have a creep feeder for extra nutrition, where we're going to mix some pellets, some baby pig restart, made into a gruel, and we're going to feed it twice a day. My graduation pen is just going to have a higher energy diet of some pellets versus what's being fed in the rest of the general population. So, I'm going to pull a pig out of this pen right here, give him a shot of Exceed. He's going to go into my hospital pen there, which has gruel. It has an extra heat lamp, that type of thing. Hopefully 5 days later, he's looking better. We can put him into this graduation pen, which we have the feeder there that has higher nutrition in it too. Maybe some pellets in it versus the grind and mix that are out in here. So that's our plan for this barn. There's an example of a nursery hospital pen. Doesn't look the prettiest there, but we've got our feeders there. We've got our heat there. We've got pigs that look like they need to be in there. Okay? There's that same picture I showed before of a wean to finish hospital pen. Here you can see a gruel feeder there. You can see one over here. There's our brooder. There's our mat. Feeder to finish barns, even in those, we need to have a hospital pen. Okay, you need to have a place to sort that pig off that's got a bum leg. Okay, that pig that maybe has a prolapse, sort him off. Just a pig going backwards. Okay, even in feeder to finish barns, we need to have, a hospital pen. Okay, how do you know when a barn is sick? Okay, the whole barn, biggest things are like looking at to determine what you're going to do with this barn is water usage. Huge deal. Record water usage every day. Okay? And hopefully you can do it at the same time. Now some controllers you can hook up to that it'll automatically read your water usage every day. Okay? If you have to read it off the water meter, try to do it close to the same time every day so you know how much water they're going through. Okay? If we see a significant drop in water, disappearance, they're sick, right? What's going on if you see a significant increase in water usage? You got a leak, don't you? Maybe you got a nipple that's leaking. You've got a water that's running over or something, right? So if you was going through 1,800 gallons yesterday, and today you look at it and you went through 2,500 gallons, pigs didn't drink that much more, okay? It went into the pit somewhere, right? What do you have to do with that then? You got to haul it out, right? So you just wasted water. Okay, so look, water usage, look at the dang pigs. I like barns where I can come in to the office entry workaway, look through a window before I go into the barn, so that I can look into that window down there and see just how the pigs are laying. Okay? Are they piled up, wet, yucky looking? Are they laid out real nice? That type of thing, okay? Listen, okay? You ever go in that barn and everything's going good? You go in there, the door slams behind you, and woof, 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 woof. I mean, pigs are flying all over the place. They're happy, they're woofing, everything's good. Okay, know what a normal barn sounds like. Then you got barns where, you go in there and the door slams and they get up and start coughing. You know, obviously listen when you go into a barn. Okay? How does the air feel? You know, if you've got pigs that are in there that are sick, that are scouring, and the floors are all wet, it's going to feel more humid in the barn. Okay? So, just, I say, look, listen, and feel when you go into a barn. Okay? Water meds. Okay? I don't want you to look at the exact numbers here, but, you know, water meds when more than 5% of the pigs are showing clinical signs. Okay? Depending on your operation, that number might be 2%, it might be 5%, it might be 10%. 5% is kind of where I boil things out a little bit. If I got 5% of the pigs sick, I'm going to put something in the water. If my daily injections continue to keep going up every day, then I look at putting water meds in. Okay? The big thing is, if you put water medication in, you put antibiotics in the water, make dang sure that you're still injecting those individual pigs. Okay? Sick pigs don't eat feed, and they don't drink water if they're really sick. So you got to keep injecting pigs. There again, what antibiotic do I choose? You got to know what you're treating. Work with your veterinarian to know what antibiotics you should be putting in the water there. Okay. The other thing you need to consider with water antibiotics is if I'm treating a pneumonia thing, I need to make sure that antibiotic that goes into the water is absorbed into the pig through their whole system. Okay? An example of that is neomycin, Neomix or Genomed. Those drugs are not absorbed up into the system. They stay in the gut, which is okay because most of the time we use those to treat gut issues. But don't be thinking that you're going to put neomycin in the water and it's going to get into the lungs, because it doesn't happen. So there again, have a chart, have the discussion with your veterinarian, what antibiotics you should be using in the water. Here again, it doesn't make a difference if OTC is the cheapest drug there is, and I can put it in the water for almost nothing, but if I'm treating E. coli, it's not going to work. Okay? There's not a whole lot of antibiotics, like on this chart here, that work against E. coli. So make sure you're choosing the right drug. There again, you'll notice a lot with water meds, there is not a huge variance here when it comes to cost of water medications. Okay? It's really more important to make darn sure you got the right drug in there. Okay? Because they're all pretty close to reasonably the same price. Okay? So get a diagnosis. How many of the pigs are affected? Last thing to consider is what's the cost, because that's all going to be pretty close. Feed medication. Main thing to remember is sick pigs don't eat. Okay? The other thing is feed medication levels are set. That's the rules. Okay? But, sick pigs don't eat. So I usually say I want to have a plan and a budget in place for normal production. Okay? This is an example. Our N1 ration is going to have Denagard, N2 and N3 is going to have Mecadox, N4, no medication, F1, Denagard. Okay, this is our plan for normal production. Everything goes good. This plan seems to work pretty good for us because sometimes I see a little E. coli about this time period here. Mecadox seems to control that. I see a little bit of maybe some lameness, maybe a little cough at this stage here. So we run that as kind of a preventative. And they're running Tylan at the end for ileitis control. Okay? Have a plan in place for normal production. Okay? On an individual group basis, Medicaid is needed with injections or water. Okay? So this is our plan for our flow. I get 1,200 pigs every 9 weeks. This is our plan here. Okay. Here I had a group that got sick. I'm going to inject them with this antibiotic. We're going to put this water, So, feed medications are not very effective when dealing with an acute disease. Okay. So, I don't hear it quite so much, but I used to always hear, you know, my pigs are coughing, doc. What antibiotic can I put in the feed? Well, you can put OTC in the feed, John, or you can put CTC in the feed, or Denigard CTC, but you know what? If they're sick, how much feed are they eating? You know, well, doesn't look like they're eating much because I should have had to grind yesterday and the bin's still half full. Okay, so feed medications, not very effective at treating acute disease. Okay, overall medication use, feed medications, not a replacement for water medications. Water or feed medications, not a replacement for injectables, because sick pigs don't drink much. They usually don't eat nothing. Okay? I think it's our job to practice responsible antibiotic use. Okay? Take the appropriate steps to minimize the need for antibiotics. Okay? You know, maybe those pigs don't need a shot of Exceed or Baytril, that small pig. He's a small, healthy pig. He just got the hind teeth on that sow. He's a little bit smaller coming in. Does he need a shot of antibiotics? He probably just needs a little better nutrition, right? Okay. Make sure that you're looking at the advantages, disadvantages of all antibiotics, and just use them when they provide a benefit, okay? Going forward, make sure that you remember antibiotic use does require a veterinary client-patient relationship. As of a year from now, all injectable and water-soluble antibiotics will be prescription only. Okay, that's some of the new rules that are coming down the pipeline here. So you will need to be working close with your veterinarian on your antibiotic therapies and that type of thing. And many feed-grade antibiotics will be VFD. Okay, CTC as an example. You used to be able to not need a VFD. You will need a VFD going forward with that.